Hello, it's my pleasure to join you to talk about the development of the wound care pathway. I'm Dr. Caroline Dowsett. I work as a nurse consultant in tissue viability in London here in the UK, and I'm also the clinical lead for the leg ulcer service. And I spend the majority of my time caring for patients who've got chronic wounds. And I'm always looking for solutions for how we can do that better. And I do believe that the pathway that I'm about to tell you about will make a real difference to people who suffer from chronic wounds. And I guess we need to start by looking at this from the patient's perspective. And we know that people who suffer from chronic wounds have a reduced quality of life. Often they report that their wounds leak, that they're offensive smelling, they've got malodor, and they have pain associated with peri-wound skin damage. And often that leads to extension of the wound itself and further delayed wound healing. And of course, when you have these problems, there's also the risk of complications such as maceration and infection. And when we talk about the wound care pathway, it is within the context of a holistic approach to managing these patients. And that is identifying the underlying cause of the wound and treating that and any other contributing factors that are going to delay wound healing, assessing the wound itself, the status of the wound using a structured and systematic approach, for example, the triangle of wound assessment, and then developing a management plan for that patient in collaboration with the patient. So really they're the underlying principles of the wound care pathway. But we know there's a need for this. Clinicians tell us they're looking for more education and guidance. Often they have limited training and they tell us that established guidelines are often lacking in their areas, and if they have them, then they're not being implemented. So learning by doing the work on the job is the norm. And if you're learning from someone who isn't practicing evidence-based practice or following a pathway, then there's always the risk that the patient is not going to get the correct level of care. So these are the reasons underpinning why we have developed the wound care pathway, because we wanted to take new evidence from the Consensus Project and develop a practical, evidence-based and easy step-by-step pathway so that healthcare professionals could use this in clinical practice. And I guess when we talk about new evidence from the Consensus Project, it's worth remembering that this evidence has been, which is the fundamentals on which the pathway is based, has been peer-reviewed and published in an international journal. And those publications focused on managing the gap to promote healing of chronic wounds, closing the gap between the evidence and clinical practice, which is what this pathway is trying to do, preventing and treating infection in wounds, and advancing practice through holistic management. So the pathway is underpinned by a very clear and robust consensus that has been published. So let us take you through the process, starting in Q2 of 2020. So you can see that this has been a very robust and lengthy process, but with momentum, which has been fantastic to be involved in. So we did a number of activities, and I'm going to take you through those activities from surveying the wound care participants, the people who participate in the wound care days, going out to survey non-specialists, then really drilling down to have those focus group meetings to get some feedback on the pathway, and then that final review and approval from the expert panel. So let us start with that first step where we sent the survey out to the participants from the wound care days. And the reason we did that was to understand the principles we should use when developing the wound care pathway. And the results from this survey told us that the pathway should be evidence-based, it should be easy accessible for nurses and doctors, it should be visual with pictures and graphics, and it should be patient-centered. We also wanted to understand what the wound care pathway should include from the perspective of the participants in the wound care days. And what we learned from this is that it should focus on how to prevent and treat infection and biofilm, how to manage the gap between the wound bed and the dressing, so wound bed preparation, exudate management and dressing choice related to that. It should focus on how to conduct a holistic wound assessment and how to do reassessment and when to do reassessment, and of course when we should refer that patient to a specialist and the ongoing multidisciplinary team. In step 2, a global survey was sent out to specialists and non-specialists. So here we're trying to gauge those non-specialists in terms of their needs for the wound care pathway. And we had respondents from 2,194 participants in this survey, which is really phenomenal. And what we wanted to do was to gain insight on specific topics in wound care. And the results from this big survey, which was a global survey, was what should be included in the care plan. And participants said the cause of the wound, the patient and family adherence, the patient's lifestyle, medical history, and the psychological health and well-being of the patient. They wanted to see wound assessment tools used today, the frequency of wound assessment, and when should we reassess the wound. And then what should be considered when conducting that holistic wound assessment. They wanted some focus on why wounds become infected and why and how to manage the gap. So here we're starting to see some of the more detail required for the pathway. And then in terms of the process, the next step was to have some local focus group meetings. And we did that in 8 countries around the world, and you'll see those countries here. And what we wanted to do was to get some insights on that first draft of the wound care pathway. So as the work's coming together, get that feedback and get that engagement from people on the ground who will be using the pathway. So the feedback from the focus group was that it was easy to understand. They felt it was intuitive to use. They felt there was a clear step-by-step process and that it would support clinical practice. Participants immediately recognized the potential in supporting patient education and supported self-management. They did, however, say that it was too text-heavy, and that's often the case when you're doing pathways. They need to be more visually stimulating for people to use. They wanted more information on cleansing and debridement and more visual pictures to help understand different wound conditions and how you would manage them. And then we come to step 4, quarter 1 of 2021. Very exciting to be getting to the end of this very robust process. And this step was review and approval, and this has happened just now from the Coloplast Global Expert Panel. And you'll see that there's a widespread group of experts from different countries that have fed into signing off the pathway. So the objective here was to ensure correct and evidence-based content and to include the feedback from the surveys and the focus group meetings. So I hope you can see that the process and the foundation of the wound care pathway is very strong and robust. Process. It's been very exciting for me to be involved in the process and to work with Coloplast, who have listened to what we've had to say. They've listened to our experiences in clinical practice, and they've brought it all together in a pathway that I believe will be useful for practitioners. So really this process has been about developing a pathway by clinicians for clinicians to improve patient outcomes, and I hope that you will take the opportunity to take the pathway back to practice and to make a difference to your patients. So I'd like to thank you for your attention. I wish you all well. Goodbye and stay safe. Thank you.